Hello.
Hi.
How are you?
Good. How are you?
Doing well. Let me stop sharing for just a second. Put my little lip gloss on. So it is 5:59. We're supposed to start well, my time is 5:59.
Yeah,
It's
it's my 7 my time.
yeah, so it's 7. We'll give it 2 minutes and then we'll go ahead and start. We won't give more than that. We do know this is a voluntary session, but there might be some others coming in. So we'll give them 2 minutes. Otherwise, we want to be respectful of your time. So we'll get some moving here. About 2 more minutes. Let me see, can I play this from the beginning? Let's see. Slash. Wait a minute. This is okay. Okay, 6:01. 1 more minute and we'll get started. So your exam is next week. Whatever day your class is. Let's see. Yeah. And we are posting in the course rooms all of the reviews from each of the professors. So you will have that also available to you.
Are all of these the same um PowerPoints, or do you guys all make your own?
I've made my own.
Okay.
Yes.
Will you share it, or I know the other teacher said she wouldn't.
I wonder. I guess I need to ask. I thought we could, but I'll ask.
Okay.
Okay. So it's 6:02. Let's get started. And so we're reviewing the concepts for exam 1. So it is going to be interactive. I'll talk and I'll just try to get you to talk as well, just so that to ensure your
Okay.
understanding of the concept. So we're here, health risks. They can be reduced to a variety of approaches. So health risk reduction is based on the assumption that decreasing the number of or the magnitude of risk will decrease the probability of an undesired event occurring. So the key word is decrease. So that's what we're assuming. So some examples of some health risks are alcohol and drug use, and then more specifically, adolescent substance abuse. So what would be ways that we could or the family could potentially decrease this health risk? And the health risk is alcohol or drug use. What are some things that family could do?
Not have alcohol in the house
Okay.
for like a teen, or just for everybody in the family?
Everybody, and specifically for teens. You can just,
Okay.
mm-hmm,
I'd say be more involved in the teen's life. Like,
mm-hmm.
um teach them about alcoholism, or what happens when you drink and do drugs.
Exactly. So by not having the alcohol and drugs available, the parents not involving in those activities, and also, like you say, be more involved. Have those conversations. Discuss. Well, hey, this is what happens. The pros and cons. So that's good. Good. Health risk appraisals. The process of assessing for the presence of specific factors in each category that have been identified as being associated with an increased likelihood of something, whatever that something is. So we are assessing, we do our head to toe assessments, and essentially it's the same thing. We're using all our five senses in that process. We're questioning, trying to gather more information about whatever that something is. For example, if it's a disease, specifically if it's cancer, if it's an automobile accident, what would we ask the patient? What would we ask the patient if we were talking about cancer? What are some things that we would ask?
Hit their family history,
Okay.
their lifestyle.
Okay.
I don't really know.
Like dietary, like what are your dietary?
Yeah,
How are you eating, your
yeah,
exercise?
right, yeah,
Good.
their lifestyle.
Good.
If they smoke, I guess that would be probably a part of their
Yes.
lifestyle.
Exactly. So now let's talk about automobile accidents, specifically for adolescents. If we were assessing adolescents in automobile accidents, or we're trying to prevent them, what would be some questions we would ask the patient?
If trying to prevent an automobile accident or after they've already had one.
Prevention.
I guess distractions, don't text and drive if we're asking them about it.
Okay, are you using your phone? Are you
Yeah,
texting and driving? Exactly.
paying attention,
Mm-hmm.
the music.
Mm-hmm. What about that thing that we're supposed to be
Oh,
wearing?
seatbelt. Yeah, seatbelts.
Yes.
That's important.
What about
Definitely.
2 to 4 year olds? What information or what conversation, what would we be asking that parent about 2 to 4 year olds, and we're trying to prevent automobile accidents?
Where if they're in a, I would say if they're in a car seat, if
Car
that's what you
seat,
mean.
more specific for them, car seat. So when
Yes.
you're doing when you're taking exams, make sure you identify what the concept is. Like, what are they talking about? Here we're talking about health risk appraisal. We're assessing the risk. And then a step further, what is our population? Is the population a set of people that have cancer, or a set of people that have diabetes? Are they adolescents? Are they 2 to 4 year olds? Are they elderly? Because your response is going to be different based on the age. Okay. So again, let me just reinforce, for adolescents and automobile accidents, we will talk to them about texting and driving, wearing seatbelts. And for 2 to 4 year olds, we will be asking the parents about, do you have that car seat? Is it installed correctly? Okay. Family crisis. What do you define, if you were telling someone what a family crisis is, what would you say that it is? How would you describe, or your definition of a family crisis?
Something that's happening in the family,
Mm-hmm.
like a death of somebody in the family. Anything that is, I guess, that would affect their normal family. Oh, yeah, right there.
Exactly.
Yeah.
Yes. And so if we are evaluating whether or not someone is coping with that family crisis, some things that we could look at, okay, we're going to say, if they're dealing with the family crisis, are they coping or not coping?
Oh, wait, are you asking me if they're not
Yes.
coping?
Yes.
I don't know what is the question.
So the question is, we've already identified what a family crisis is, something
Right.
outside of the norm. And
Mhm.
we're trying to determine whether or not they are dealing with the family crisis appropriately.
Mhm.
And so the question is, would we say that they're coping or not coping if we say that they are dealing with it appropriately?
Oh, coping.
Okay. If we would to say that they were not dealing with the family crisis and they were not coping, would they appear organized or not organized?
Not organized.
Organized. Okay. And to take it a step further, would we define the family as functional or dysfunctional if they were not coping and were unorganized or not organized?
Dysfunctional.
Dysfunctional. Okay. All right. So a family crisis is the family is not able to cope with an event and becomes disorganized or dysfunctional. That potential is there. The demands of the situation exceed their resources. For example, if something happened to the person that is the breadwinner of the family, then their resources are going to be limited or none, compared to if that person was there. So we want to ask questions. Ask yourself, is the family member overwhelmed and unable to conceive that they're able to, how to cope? So that's when you're dealing with a family crisis. That's something that you want to ask yourself while you are interacting with that family. Is that family member, do they appear overwhelmed? And how we know that is by the things that they say and the things that they do. To take it a step further, what are some examples of what you might hear someone say if they are in a family crisis?
What would they would say? Oh, I would think overwhelmed.
Okay.
Stressed out.
Okay.
I would say can't cope, but that's one of them that are already on there.
And I'm just we just reinforcing what we've just said. So yes,
Yeah.
Yes. Okay. And the family is not able to cope with an event, becomes disorganized or dysfunctional. Is this what we just said? The demands of the situation exceed the resource. I think this is the same slide I just had. So we'll go to the next one. Okay, assessment of the family. What should be established? Okay, no, let me go back. Let's talk back about, I may need to change this slide. So we are trying to determine whether or not a family is dealing with the family crisis. So here's an example. The Miss Mary states that Bob is no longer here. What are we going to do about the rent, the mortgage, about our groceries? Can you give me some resources that might provide me some financial support? Is that a person that's coping or not coping?
I would think coping.
Okay.
Or at least trying to, anyways. I mean, I would
You're
think
correct.
so. I mean, they're trying to figure out ways to deal with what's happening, losing
that is correct. So if you're interacting with them and they are not identifying or trying to at least, reach out for some resources, even if that resource, hey, can you give me some counseling? Right now, I'm just confused about what to do next. Can you tell me who I can go talk to? But if that person identifies the situation and do not ask for resources or seek out resources, then they are not coping with the family crisis. So let me say that again. So our topic is our concept. Remember, we're identifying the concept, and it's family crisis. So we want to determine whether or not the person or the family members are coping, are they functional, not coping, or dysfunctional. So even though the people or the family members, they state what the situation is, because that's real. They stating what the situation is. But the difference in whether or not they're functional or coping versus non-functional or dysfunctional and not coping is when they state the situation and they do not try to seek out other resources, whether or not that be counseling, a program, a help group, or resources like Habitat for Humanity. These are people that come in, or some type of resources that provide financial resources, whatever that resource is. So that's the difference between whether or not they're coping or not, or functional or dysfunctional. Is that clear, or do I need to go back over that?
No, I get it.
Okay. And I'll just remove that slide because that was repetitive. All right, assessment of families. What should be established before beginning an assessment of a family?
I have a question. I'm sorry. Somebody is trying to log in, but they weren't sure if they could if they were like not at home. Is that allowed? I mean, they're not driving or anything.
They're not driving. Okay.
Yeah.
That's fine.
Okay.
So before we assess our families, what should be established before? What are those things that we need to do or think about before we go out to assess our families? Let me go back. Before you get and just think about before you do a task or before you go in to, perform a procedure or something.
Know about them, the situation.
Okay.
Before we go and assess the families, like if they're having a crisis, you mean what?
At any given moment, like we're going in just to to seek out. We have a program. We're gonna say we have a program that we want the family to take part in.
Mm-hmm.
And so we've identified this family could be a potential family that could participate. So
Okay.
we're going in. What are some things that we need to establish or know or be thinking about before we go in?
Um, is this like the culture thing? Is this one of those questions?
Yeah,
Like
I mean,
they're
that can be
they're
included.
yeah,
Mm-hmm.
the I guess what their beliefs are.
Mm-hmm.
Um, I don't really know.
So what is your purpose for the assessment? Are you getting ready to introduce them to a
Yeah.
program? Are you getting ready to provide them with some type of service or introduce them? And we talk about the family. Who will
Mm-hmm.
be there? Who's going to be present? And the people that are going to be there, do they need or have a need for any type of, for example,
A translator, maybe?
translator, because they
Yeah.
might
Okay.
need that.
Mm-hmm.
How will you obtain the necessary information? Is it going to be through Zoom? Is it going to be, are
Yeah.
you actually going into their home?
Right. Okay.
And then like when is this visit going to take place? What's a good time of day? When will most of the family members be available? Because remember, it's a family assessment. So you want to assure that most of the family,
Make sure all of them there. Okay.
exactly, or at least most of them.
Right.
Yes. And then we kind of touched on this. How do you know if the family is healthy or functional? What will the conversation interactions look like?
Um, I would think happy, organized, well organized. I wouldn't say maybe well organized, but organized. Communication. They're
Mm-hmm.
talking to each other.
Mm-hmm.
Um, there's not anger, or I don't know if that's even available in a family. Um, Asking questions, wanting help.
Exactly. And so there's open communication among the family members. It seems like everything is natural. Even if they have
Mm-hmm.
if they're playing or being humorous about something, it
Right.
seems like it's natural. There's
Right.
balanced interactions. For example, the mom is talking, she allows the child to talk and allow the uncle to talk or whomever is there. It's balanced interaction. It doesn't look like someone's trying to prevent the other one from saying something or doing
Right. Okay.
something.
Right. Okay.
Yes. And they express, what their value system is. Hey, I know you're here, but this is what's important to us.
Mm-hmm.
They're just not going along with everything that you say.
Right.
All right. And so let's look at the flip side. And we're assessing a family and we're like, this family is not healthy. They're non-functional. What would that conversation look like?
Oh, I would think just against it, anything. Not paying attention. I don't know. I'm
Mhm.
just imagining my family more so.
Okay. Communi-
um,
communication.
Communication. Yeah, lots of yelling, I would think.
Okay. And then
Maybe closed off.
exactly closed out? Would everyone be talking or would it just be a few people that's saying something?
I would think just a few. Yeah.
Just a few. Exactly. Because they don't want the other member probably to say something to give away whatever's really going on.
Mm-hmm.
Exactly. And even there's not mutual play or humor, and it seems like the person is afraid. The interactions are imbalanced. Something just was off about that person,
Right.
and so that would be the feel or what you would see those interactions would be. So for non-functional or not healthy, the key is only a few members are actually communicating versus a functional or healthy family. Everybody's engaged, even if they're
Right.
talking about something that's not relevant to, what's going on. Because, many times you have children in a setting, they're
Yes.
talking about something else, but still they are actually talking.
Right.
Okay.
They speak up and they're not scared too.
Exactly. Exactly. And that's the whole gist of it. Okay, so do not resuscitate, order an advance directive versus a living will and a durable power of attorney. Let's talk about the DNI order first, the do not resuscitate order. What is that?
That's if somebody is passing away, or like they don't want to be brought back. They don't want to be, like, don't help them if they're coding. I don't really know
So
how to explain it, but I know what it is.
Okay, so it's an order from the physician that specifically states do not perform CPR.
CPR, right?
Yes. Okay. So living will. So are you able to see my screen?
Yes.
Okay,
I'm looking at it. Yeah.
I tried to add some visuals in to help the concept to stick. So living will, it allows the client to express their wishes regarding treatment, and it's like in writing.
Right, before they, well, yeah, they would have it, not necessarily before they pass, but while they're still maybe healthy and,
Exactly. But it is a document that's in writing that specifically expresses what that patient's or that client's wishes are. Now, a doer power of attorney, that is someone has been designated to make those decisions.
Right. But that's not necessarily the person that is sick doing that, right? That's like, right. Okay.
Okay. So for example, if you decide, or if I decide to let my cousin Mary make decisions for me, they would call upon her in the event that a decision was need to be made about my health care. But the living will, I have written in writing, hey, I want you to do this or not do this. A person making I've left a person to make decisions.
Right.
Or either I've left in writing. If I left in writing, that's a living will. But if I've designated someone unmarried, then that's a dual power of attorney.
Okay.
Okay. And then the advanced directive includes both of those. It's a broad category that includes both of them. The living will and the dual power of attorney.
Right.
Okay, so did that person come on in? Because I don't see anybody else on this.
No, he said he didn't want to be distracting. He's got a volleyball game for his children. So
okay. So what's the purpose of the Nurse Practice Act?
I'm sorry, what?
The Nurse Practice Act. What is the purpose of it?
The rules, I would think. How to protect us?
Exactly, to protect us, the public. That's the overarching goal. It specifically sets minimum qualifications for nursing in relation to skills and competencies. It defines the scope of nursing practice in whatever state you're in. It tells us, our do's or don'ts, in as far as us going to take our state boards. But the overarching goal is to protect. It's to protect. All right. So school nursing responsibilities. So
it's really hard to see. I'm sorry to interrupt you. It's the letters, because they're white and they're, I don't know.
Okay. I need to change.
It like disappears. Yeah.
Okay. So it's just saying, what are some responsibilities of a school nurse?
Oh, I've heard that they are a lot now. The other teacher that I have, she's told me that when she was a school nurse, that they do lots. But it's what's the responsibility? To protect the children. Okay. I guess to make sure there's no outbreaks. Is that right?
Okay. Okay. So
keep children healthy, but I've heard a lot of stuff now.
Okay. So school nursing responsibilities include making sure that children get the health care they need.
Right.
And while they're at school, whether it be a Foley catheter, or in-minute and Foley catheter insertion, administer medication, provide emergency care in the school.
Right. See, when I was in school, I didn't know, my school nurse I didn't think they had that many, like responsibilities for catheters and all that.
Keeping track of state required vaccinations that children have received.
Right.
So, they bring the blue cards or the exemption. Carrying out required screenings. We do the scoliosis, where they do the scoliosis screenings.
The head lice.
The head lice, exactly. The overall goal is to ensure that children with health problems are able to learn in the classroom. So this is an example. Is this a responsibility of the school nurse to administer medications to all children?
No.
Okay. Is it a responsibility of the school nurse to administer medications to all children that they have a order to administer the medications to?
Yeah.
Okay. All right, good. Welcome.
I'm sorry I'm late. I was in Professor Price's review as well, and hers kind of went over. So I'm sorry.
Oh, no problem. We will share all of the recordings.
Okay.
Okay. So Healthy People 2030. What is the purpose of this Healthy People 2030? And I tried to give us some visuals too to help us. What do we know about Healthy People 2030?
It increases health equality.
Okay. So it creates and it changes every 10 years. It does 2020, 2030, and it just goes on from there. So it sets these national goals and measurable outcomes to guide evidence-based policies and programs. And like you said, it's supposed to increase health equity. Policies are supposed to be created. Leadership should be engaged. Key constituents and all parties should be on the table or at the table to help create these policies and also opportunities so that people can be as healthy as they could be, providing resources so that communities can create sidewalks and have parks and things so that people can walk and the children can actually play. Create health initiatives so that their school lunches are better or more healthier. And so it's so many things that people can actually do. But the whole point of Healthy People 2030 is to have that equal playing field, and also to create these national goals to keep people on track. And so they've gathered information about, mortality, about health disparities. And so that's where they get those goals from. So that's how they focus on those things. So it's not just things that they're just pulling out of the air. They have actual evidence that says, hey, this is a problem. Diabetes is increasing in the nation. So, okay, let's create a goal and some measurable objectives so that our policymakers, so that our leadership can create or design or provide opportunities. What's the thing with children? They have seen the statistics about I don't want to say what automobile accidents. I think that's the number one thing for adolescents. So the goal is, our objectives are specifically towards that. So yes, health equity, promote healthy development, healthy behaviors, and well-being across all life stages is their focus. So an outcome of counseling, what is counseling an outcome? What is the purpose of counseling? When we look back at and evaluate what the person was there for, we want to say that the following were done: that the person was well informed. We want to ensure that we gave appropriate instructions and information so that person could make an informed decision about whatever it is, whether or not it's contraceptives, whether or not it is about a disease process and a new treatment that's being put out or being made available. We should have a non-judgmental approach about whatever it is the client decides, because some things we deem that are important and we're like, oh, this would be a great intervention for you. This would help you, would increase your, likelihood, your health or whatever. But if the client does not want to, we should be okay with that. We should be non-judgmental. And remember, reduction in the health risk of the individual is the goal. It's the goal. But we still have to provide enough information so that the client can make an informed decision and be non-judgmental about counseling. Any questions about that? Okay. All right, levels of prevention. So how many levels of prevention are there?
Is this the 3? Primary,
okay.
tertiary.
Okay. And what are they?
Primary is prevention, like preventing something from happening, like immunizations.
Mm-hmm.
Secondary is our screening, diagnostics, testing. And tertiary is they already have the disease. So we
Mhm.
want to educate them and make sure that they stay up on like medications to take care of the
Okay.
issue.
Primary prevention addresses the use of interventions before disease or an injury occurs and to reduce the risk of developing the disease or the injury. Secondary prevention is aimed at detecting the disease early through screening programs and early intervention for at-risk individuals. So we can give a survey, we can actually administer TB skin tests, and so forth. Then tertiary prevention includes those interventions aimed at disability limitations and rehabilitation from a disease, injury, or disability. All right, so here's some examples, and you tell me which level you think the prevention is. A nurse advises a client diagnosed with active communicable disease not to donate blood, plasma, or organs.
Tertiary.
Okay, and because there's some disease process there, no matter what that disease process is. Okay, do we agree, Christina?
Yes.
Okay. The employee health nurse knows that it is one of his or her duties to offer the staff yearly tuberculosis or TB screening and free treatment for those who test positive for TB.
Secondary.
Oh.
Mhm.
I'm sorry, I'm gonna be quiet.
No, you're fine.
Okay, the public health nurse is having a weekly meeting with 20 to 30-year-olds with diabetes. The nurse monitors blood glucose levels and provides teaching on modifying diet, exercise, and medication compliance.
Primary?
I'm stuck under the golf cart. Oh. Okay, we're good. We're good.
Is that wrong?
Brittany, what you think?
Oh, we both said primary.
Oh, I only heard one person. Okay, I didn't hear you.
Oh, I did mute myself and I was like,
Yeah.
Okay, the school nurse is asked to attend the PTO parent-teacher meeting monthly. The nurse task is to provide educational programs about injury prevention.
is that primary as well?
Okay,
I think so, right?
yes, because there is prevention. Nothing has actually occurred yet. Okay. I think this is the end of my PowerPoint. Let me stop sharing.
So the PowerPoints that you all are showing us, because now these are two different ones, I actually like yours really a lot. They'll just be in the videos. We won't be able to have the PowerPoints, but they'll just only be in the videos.
Yeah, that's what I was asking.